Thank you, Mr. Speaker. My question is to the Minister of Health. Speaker, in September, Nelson and Kathy Samuel of Gravenhurst went public with an issue that they are facing. While on a vacation to Whitehorse to visit their daughter, Nelson's knee became infected to the point that he had to be transported by medevac to Vancouver for immediate treatment. It saved his life. The Samuels are now facing a bill of $18,400. They are seniors on a fixed income, and this cost would be a big hit on their retirement savings. They even checked with OHIP before making the trip to make sure they had coverage. So, Speaker, to the Minister, what assistance can be provided for Nelson and Kathy in their time of need?
Thank you. Minister of Health, Long-Term Care.
Well, thank you, Mr. Speaker, and I appreciate the member opposite raising this issue, and I think with the permission of the family, I would be interested in learning more about the specific circumstances involved. A number of members of this legislature have come forward to me directly when such a circumstance does take place, and thus far, Mr. Speaker, I think that we can say that we've made significant efforts to resolve these specific challenges, but it does point out a deficit. I think I would describe it as nationally for people when they are traveling out of province. We have arrangements with all the provinces and territories and the federal government for reimbursement of health care costs, but to date, and this is partly due to because of when these measures were put in place, they haven't accounted for the type of air transport that the member opposite has alluded to with this example.
Answer. Supplementary.
Thank you to the Minister for that response, but through the Speaker again to the Minister of Health. Speaker, it has been over a month since the Minister spoke to CTV News about this specific case, and he said, quote, "We want to make sure that Ontarians, when they travel, that the right to have an expectation that urgent and immediate health care costs will be covered," close quote. Recently, there was a case in Alberta of an Alberta mother who gave birth prematurely in a Timmins hospital. In the end, she had her emergency travel costs covered jointly by two separate provincial governments. Minister, the clock is ticking as the Samuels bill has now been transferred to an agency for collection. So through the Speaker, will the Minister commit to help my constituents, Kathy and Nelson, with the massive bill they are now facing?
Thank you. Minister.
Thank you, Mr. Speaker. And in fact, the Alberta case that was referenced was, it was covered by the private insurance that the family in question had. But that being said, I made the commitment at that time, and we have a federal, provincial, territorial meeting coming up in January in British Columbia, that I've asked our partners across the country to have a discussion about this specific issue. I think it's important and timely that we update the reimbursement that is available between provinces and territories. It doesn't, as I mentioned, currently cover air transport of this nature, often individuals, and I would certainly encourage any individual or family traveling outside of the province to have private health insurance to cover all necessities of travel if untoward circumstances do arise. But I have asked for this specific issue to be put on the national agenda so that we can address it in a comprehensive fashion across the country.